Hi, this is Dr. Higgins with Calm My Pain, and today I'm going to be talking to you about 5 stretches that are beneficial for both acute and chronic pain. These stretches can be done by anybody. These are things I have found to be very helpful for a whole body approach to pain management. The first stretch that most people need to do is Iliopsoas Stretch. This is your hip flexor, or the muscle that lifts your knee. Make a fist, push your hip forward with your knee on the ground and hold it for about 30 seconds. You're going to stay in this position and you're going to stretch the other side also. There's an alternative, which is the iliopsoas plus the quadriceps. So in this version, you're doing the same thing, but you're including the quadriceps muscle. You're going to hold this position for about 30 seconds, but also stretch the other side. The next stretch is the SI joint and low back stretch. So in this case, you're going to, with your left hand, grab your right knee, pull it across your body, toward your shoulder. This stretches the lower part of the SI joint, or the sacroiliac joint. You're going to hold it there for about 30 seconds. Then you're going to let go. Bring your knee back to position, and then you repeat the stretch, but this time you're going to pull the knee straight across. This stretches the middle part of the SI joint. Along with stretching the SI joint, it also stretches some of those low back muscles that are often very tight. We're going to repeat this a third time, this time pushing our knee toward the other knee or toward the other foot, kind of pushing it down. You're going to hold this for about 30 seconds also. You're going to repeat this stretch on both sides of your body. The third stretch is the shoulder, upper back, and neck muscle release. In this stretch, you're going to grab your elbows. You're going to hold your elbows above your head and just let it sit there. The elbows will slowly kind of ratchet toward the ground. The best place to do this stretch is on a carpeted surface, not in your bed, too soft. Once you're done with the stretch, your elbows kind of fall onto the ground. Let go of your elbows and just lay there for about a minute before going back to neutral. The next stretch is really not a stretch at all. It's called the diaphragm release. The diaphragm is the muscle that controls your lungs, and it often gets really tight. First, find the bottom of your rib cage, then place the lacrosse ball that you received in your pain pack about 2 inches below that. Next, you're going to lay on the ground. You're going to put the lacrosse ball right in that spot and just lay on it. This is painful. It's actually helpful to release the diaphragm because the diaphragm attaches to half your ribs. So it causes a lot of tension in the upper and lower back. So you're going to lay there for a couple minutes. We're going to use that same lacrosse ball for the head to toe release. First, use the lacrosse ball on one side just below the skull. Kind of lay on it, let it release that muscle. You're going to do the same thing on both sides. You're just going to hold the lacrosse ball there, letting it release the muscle. This is called the suboccipital muscle that often causes a lot of neck pain and headaches. Next, put the lacrosse ball just behind your shoulder blade. Find where it's tender and let it stay there. You're going to do the same thing to whatever tender points you find, just kind of rolling on that ball, releasing those points, doing the same thing on both sides. You can do the same thing up against a door or a wall. In this picture, it shows kind of where that lacrosse ball is near the shoulder blade. This shows the lacrosse ball near the SI joint. The last thing I'm going to show you is using that lacrosse ball to kind of stretch out the arch of your foot, which can help with plantar fasciitis. You can use this ball in multiple different areas. It's actually super helpful to kind of just take your time finding tender points and just releasing those points. The last thing I want to talk about is exercise. Now, it's super important for anybody who has chronic pain, or actually anybody in America or the world, to exercise. We all need to exercise every day. Now, I don't expect you to run a marathon or go to the gym and lift 500 pounds. but just exercise every day. Take some time walking. Use some good quality running shoes. You can only walk in good quality running shoes for about a year before you need to replace them, so make sure your shoes are fairly new. Or if you don't like walking, use an elliptical or swim. Those are all three of those exercises are nice full body exercises that will help to decrease your pain levels, because exercise will help increase the oxygenation of the muscles in your body. It's been clinically proven to decrease depression, to decrease insomnia, and to decrease low back pain. There's lots of studies about exercise in all these different areas, and it's just going to make you lose weight. It's going to make you feel better. Everybody loves how they feel when they're exercising regularly. Super important to do this. So when you combine these specific stretches with daily exercise, it's going to be super helpful. Hopefully, this is a big part of the change that happens in your life when you take on this program to take control of your pain and to take control of your life. Thanks for watching.